Good morning, everyone. My name is Freya Kelly, and I am an advanced practice nurse here at the Heart Institute with the Cardiac Supportive and Palliative Care Program. Thank you for joining us today for another session of the Heart Failure Cardiac Rehab Virtual Group Education Series. The purpose of this presentation series is to help you learn to live well with heart failure. In today's session, I will go over advanced care planning. As this might be your first session, I will go over this disclaimer. In the group sessions, it will be important to keep confidentiality. For this reason, I will ask you not to use your last name. The information presented at this session is not a substitute for, nor does it replace professional medical advice that you receive. If you are feeling unwell, please seek medical advice, follow up with your doctor, or call 911. As we review this information, please consider these discussion questions and how you might answer them. Have you thought about what your goals of care are? Have you discussed these goals with anyone, for example, a family member, friend, or healthcare provider? Did the diagnosis of heart failure change your goals of care? Have you documented what your goals of care are? Do you have a substitute decision maker or power of attorney, and have you documented who that person is? And we'll review what these two terms mean in the presentation today. So by the end of this session, you should be able to understand what an advanced care plan is and why we're discussing it in a cardiac rehabilitation education series, what the 5 steps to advanced care planning are, what the difference between a substitute decision maker and a power of attorney is, the importance of documentation, and what resources are available to you. While there are many definitions out there regarding what advanced care planning is, essentially it comes down to the process of reflecting and planning for future medical care. Subsequently, you may want to write down your wishes and communicate these wishes with your substitute decision maker and your medical team. The reason why we included this particular presentation in the education series is that we know that early integration of advanced care planning in various patient populations has been shown to improve decision-making at the end of life, reduce hospitalizations and trips to the emergency department, and enhance your quality of life. Unfortunately, while most patients want to discuss advanced care planning, these discussions occur infrequently or too late. Some barriers to having advanced care planning discussions with your healthcare team include concerns about the effect these discussions may have on the relationships with both family members and primary care providers, and issues relating to the patient's knowledge and interpretation of the importance, responsibility for, or relevance of advanced care planning itself. However, enablers to having such discussions include greater public engagement and system and policy support. It is my hope that you leave this presentation feeling empowered to have these discussions with your family members, your friends, and your healthcare team. Furthermore, ideally, these discussions, which can occur over several visits, should ideally take place in the outpatient setting with a provider who has or can develop a longitudinal relationship with you and your substitute decision maker. This person is typically a primary care provider, like a family doctor or a nurse practitioner, or it can be your cardiac rehab mentor here at the Heart Institute or someone else within your healthcare team. So how do you begin advanced care planning? Advanced Care Planning Canada outlines 5 steps: thinking, learning, deciding, talking, and recording. I also found this diagram, though, which illustrates these 5 steps should be constantly revisited, and at the center of the discussion should be the patient, their substitute decision maker, and their healthcare provider. I'm going to use a mix of the two to guide my presentation today. So the first step is to start thinking about, and more specifically, preparing yourself to make decisions as situations arise, rather than making specific treatment decisions in advance. While you're healthy and well, it is a good time to start thinking about what you might want if or when you become more unwell in the future. For example, what is most important to you right now, both in life and with regards to your health? What are your values, your wishes, and your beliefs? When you think about the future, what are you hoping for? What are you worried about? It is extremely important to acknowledge that your preferences will change over time. Alongside this first step, you should also think about identifying a substitute decision maker or power of attorney and involve this person early and throughout the advanced care planning process. So before we move any further, I want to define what a substitute decision maker is, how it differs from a power of attorney, and how to choose a good person for this role. I want to apologize in advance that this section is a little wordy and specific to Ontario, but I hope it helps clarify these terms for you. So we'll start with a substitute decision maker because most people tend to have this one over a power of attorney. It is someone who is entitled by law to make healthcare decisions on behalf of a patient when that patient lacks the capacity to make the decision for him or herself. Healthcare decisions include decisions about treatment, admission into a long-term care home, and personal assistance services. Section 20 of the Healthcare Consent Act sets out the hierarchy of individuals that may receive decision-making power when a person is incapable, as seen in this diagram here. It is important to note that the Act will govern to determine which family member will take on this role without input from the incapable person. For someone to be a substitute decision maker in Ontario, they must meet 5 requirements. He or she must be mentally capable of understanding the treatment or care being proposed and be able to appreciate the consequences of consenting or refusing the treatment decision. He or she must be at least 16 years of age, unless you are the parent of the incapable person. Not be prohibited by court order or separation agreement from acting as a substitute decision maker, available in person, by phone, or via electronic communication, and be willing to act as a substitute decision maker. So switching over to power of attorney, there are 2 types, property and personal care. I'll touch on property just so you are aware, but it is a legal document that you sign to give one person or more than one person the authority to manage your money and property on your behalf. In most of Canada, the person you appoint is called an attorney. I think it's really important to note that that person does not need to be a lawyer. A general power of attorney is a legal document that can give your attorney authority over all or some of your finances and property. An enduring or continuing power of attorney is a legal document that lets your attorney continue acting on your behalf if you become mentally incapable of managing your properties and finances. I am by no means an expert in power of attorney for property and would simply recommend that if you're interested in learning more about this type, you Google it and a number of legal websites will come up explaining it in more detail. A power of attorney for personal care is a document that gives another person the authority to make decisions about personal care and healthcare decisions if you were to become mentally incapable of doing so for yourself. Personal care, think housing, nutrition, clothing, hygiene, and safety, and healthcare decisions, think medical treatments, long-term care home placement, and personal assistance services. Please note that a power of attorney for healthcare and personal care takes effect only if you are not mentally capable of making decisions for yourself. This means that you are not able to understand the information needed to make personal care decisions or not able to appreciate what might happen when you make or refuse to make personal care decisions. When choosing someone to act as your attorney, it should be someone you trust, such as a family member, a spouse, or a longtime friend. And again, some requirements for Ontario include being mentally capable, being at least 18 years of age for property, and at least 16 years of age for personal care. So what does this boil down to? Essentially, both a power of attorney and a substitute decision maker are able to make similar decisions for the incapable person. Both are able to provide consent for treatment, admission into a healthcare facility, and personal assistance service. The substitute decision maker system is important as not all individuals will have a formally appointed legal power of attorney. However, if an individual wants to choose the person who will make health decisions on their behalf, it is recommended that he or she create a power of attorney. Another benefit of having a power of attorney arises when there are multiple people that qualify as a substitute decision maker. The Act dictates that multiple equally ranked individuals can be substitute decision makers, and if they do not agree, the public guardian and trustee will step in to make a decision instead. Having a power of attorney in place will avoid situations such as this from occurring. Through feedback from other presentations, it was requested that I put together a flowchart similar to this one, just to show you what happens if you have documented advanced care planning and power of attorney or not. So we start at the top where the patient presents to the emergency department. If the patient has a documented advanced care plan, the healthcare team is better able to align their goals of care with which category status they would want, bearing in mind that this conversation should occur with each new presentation to the hospital. If the patient does not have an advanced care plan, the patient is automatically a category 1, which may or may not align with their goals of care. Over to the right, should the patient have a documented power of attorney, only the power of attorney will be contacted should the patient be incapable of providing consent or refusal for treatment. If no power of attorney is documented, the substitute decision maker hierarchy will be followed until someone is contacted, given how emergent the situation is. Regardless, a power of attorney and substitute decision maker have the same abilities with regards to decision making on behalf of the patient. So if I can stress one thing from this presentation, it is the importance of choosing and documenting your power of attorney. The Ontario government has made this extremely easy to do by providing a 28-page fillable booklet available for free online that simply requires you to fill it out and have 2 witnesses. Although not mandatory, I would strongly recommend that one of those 2 witnesses be a notary just to ensure all your loose ends are tied. And when I did my own power of attorney documentation, it was a $15 fee for the notary to sign. So I apologize for the size of this, but this is just to show that there are 2 pages to sign for property and 2 pages to sign for personal care. So if we circle back to the 5 steps of advanced care planning, the second step is learning. Part of learning includes learning about your individual overall health. A great place to start is this education series, for example, to learn more about heart failure, including its disease process and how to manage it through nutrition, activity, and medications. It is also important, though, to look at and know the rest of you as an individual, including what your modifiable and non-modifiable risk factors are. For example, do you have any other diseases or medical conditions, or is there a family history of any of this? What is your age and gender? Do you smoke or exercise? Again, I hope that I empower you to have an open conversation with your healthcare team about what your individual 5 to 10 to 20 years will look like from a health perspective, and that this conversation be an ongoing and fluid one. Learning, though, also means exploring what your preferences are for major decisions such as resuscitation and intensive care. So again, I am only going to touch on these topics, but it should be something that you have a discussion with your substitute decision maker or power of attorney and your healthcare provider to ensure your goals of care and values are respected should these major decisions need to be made. The Heart Institute has a Goals of Care pamphlet available in paper copy or electronically online that reviews various key terms and code status. Cardiopulmonary resuscitation, or CPR, is done during a medical emergency. A healthcare provider will assess whether the patient is breathing or if they have a pulse. If they do not, a member of the team will apply firm pressure to the middle of the patient's chest. They will continue to do this to mimic the heartbeat. A tube may also be inserted in the patient's mouth and airway. This is known as intubation. The chest compressions are important to continue to circulate blood throughout the body. Intubation is important to provide oxygen into the airway. Defibrillation, or an electrical shock, is given to the patient when he or she stops breathing, does not have a pulse, and/or has an irregular heart rhythm to try to correct that rhythm. This can be done several times to restart the patient's heartbeat. If defibrillation is done quickly and is successful in restoring the heartbeat, there may be immediate recovery. There also may still be the need for ventilation and medication to support the lungs and heart. At the Heart Institute, there are 4 code status levels. Although these only apply should you become hospitalized, I'll review them here so you can decide which level best respects your wishes and discuss this with your substitute decision maker or power of attorney. Again, you can change your mind at any time and should revisit these anytime your health changes. So category 1 is full treatment, and unless you choose a different category, you are automatically a category 1 when you come to the Heart Institute. Full treatment means you want to receive all life-saving measures, including CPR, defibrillation, intubation, and ventilation, admission to the intensive care unit for closer monitoring if needed, and medications to treat your medical issues and keep you comfortable. Category 2 is full treatment except CPR. In this case, you do not want CPR. However, you will still be admitted to the ICU for closer monitoring if needed, and will still receive medications to treat your medical issues and keep you comfortable. Category 3 is full treatment except CPR and admission to the ICU. In this case, you do not want CPR. You would not want to be admitted to the ICU. However, you will still receive medications to treat your medical issues and keep you comfortable. Lastly, category 4 is comfort care, in which you will not receive CPR, you will not go to the ICU, and our main focus is making you comfortable. This category is meant for patients who are nearing the end of life. I also like this pamphlet as it reviews risks and concerns. It is important to know that resuscitation is not always successful. There is a risk for injury and a risk for decrease in functional ability for survivors, which may be permanent. There is also a lower rate of survival and a higher risk of significant functional disability for older patients and those with other medical illness. It is again important to consider your own health status, your personal beliefs and values, your religious beliefs, and your personal experiences when deciding if you want CPR. You can, of course, change your mind at any time. Moving along, Advanced Care Planning Canada asks you to decide who will make your medical decisions for you should you be incapable of doing so, something we have previously touched on. Step 4 is to start talking. You may find the conversation difficult to have, but the earlier and more often you have these conversations, the more likely your goals of care, wishes, and values will be carried out by your substitute decision maker or power of attorney. Don't forget to tell others too, such as your healthcare team, your lawyer, and other family members and friends. The last step is to document. Write down what your goals of care are, who you want to make the decisions for you, and what your preferences are for major decisions. Two documents that are available to assist with documentation are the Speak Up campaign or the Plan Well guide, both available online or as a hard copy. If I may share personally, having done both, I do prefer the Plan Well guide, as although it takes more time, it is an interactive website that assists you with aligning your values with your goals of care. It also allows you to access, update, and share your plan at any time, and further auto-populates a Dear Doctor letter and a Dear Substitute Decision Maker letter at the end. So again, I apologize for the sizing of these images, but it's mostly just to show that upon completion of the Plan Well guide, it provides a 4-page Dear Doctor letter that you can then share with your healthcare team, and likewise a 2-page Dear Substitute Decision Maker letter to share with your substitute decision maker or power of attorney. Ultimately, my important points to remember are as follows. The importance of early advanced care planning and the importance of revisiting if your health changes. Remembering the 5 steps to advanced care planning, including thinking, learning, deciding, talking, and documenting. Choosing your power of attorney and including them in your advanced care planning. Having documentation of your goals of care and sharing that documentation with your substitute decision maker or power of attorney and your healthcare team. And knowing where to look for more resources. Please visit our website at ottawaheart.ca, cardiac support and palliative care program for any of the resources that were shared today or for my contact information.